Welcome to Charak. Today we talk about one of the most exciting modules of Charak around electronic medical record, which covers end-to-end business processes for clinical documentation right from outpatient to the wards, ICU, OT, as well as post-discharge processes. The outpatient EMR is typically linked to a doctor set and hence is controlling extremely high privileged access to only a doctor who has his information for his own patients. A doctor may look into his own prescriptions, could make a surgery request, manage estimates, do an admission request, or look into his own calendar. Searching for the patient, he can look into what are the kind of patients available, click on a particular patient data which are available for today, and start looking to write a prescription for the patient. All the modules that you see at the top are configurable, specific to the specialty as well as for the doctor. To make a point, something like a family history may not be there for an orthopedic patient, but an antenatal history may come in for a gynecologist patient. What you see on the left are the patient records from the past visits which have not been accessed by non-available doctors, where you can see the last prescriptions, view the past report. It might be relevant to note that the prescription here is auto-generated and completely templatized. Each of the template sections that you see have corresponding templates associated with each of the specialties and hence requires minimal typing. The solution also integrates with speech recognition software and NLP applications to convert text as well as medical vocabulary. What is also interesting to note that the entire outpatient EMR is specialty specific. The templates, the menus, the doctors, all of them can create their own context depending on the kind of specialty that they choose to proceed. Moving forward from outpatient to the inpatient side of affairs, we find much more vast set of modules ranging for those coming from the doctors to the nurses to the support staff. The inpatient module includes the EMR for doctor notes, multiple investigations, surgery requests, nursing notes, a patient face sheet on which is possibly more like a bedhead ticket, handover forms from duty medical officers, documents for plan of the care, documents for putting the patient into a curative or a rehabilitative care plan or a patient protocol as needed, including items for emergency, ER, as well as doctor monitoring on glucose, etc. In addition, the nurses use the same single EMR to configure their nursing care plans, to derive the list of orders that they have to put together, a huge amount of checklists, vitals, input-output charts. The input-output charts are specific for wards, critical care, emergency, and operation theaters. The data depends on the kind of clinical protocol that the patient has been put in and could be collected directly from bedside devices. Lastly, all of this outpatient inpatient data can be collated either as tabular information, past history, or the set of investigations and doctor notes into a final discharge summary. EMR at Charak is perhaps the most comprehensive rollouts outside of the US, where not only the data that is generated is available for the doctors, the patient relevance, as well as for statistician as the need be, but is also compliant to international standards for meaningful use as well as protection for HIPAA guidelines. Additional modules that you see here around patient registers, around operating documents, around SOPs, process charts, wellness, and associated quality processes ensure that the electronic medical record that we achieve conforms to the highest quality of patient care. Thanks a lot for listening. Have a good day.